Again, I'm Sean Griffith. I'm one of the members of the healthcare ministries here at Lourdes. And one of the things that we're trying to do with this event, our health fair that we have every year, is to really educate many of the parishioners about, the importance of getting screened, going to the doctors. It could be anything from your hypertension, blood pressure, and one of the things we focus on is knowing your numbers. The problem we have is many African Americans do not go to doctors on a routine basis. This is our way of making sure that our congregation is more educated on these events and know the importance of health. As we know, health issues and reform are a big deal, but health is a responsibility. It's a responsibility of us as a church and also our community. But our ministry is really focused not only within ourselves, but also around. And in fact, we do a health walk that is around not just for our congregation, but it's also for this community. So our table is the health ministry table for men's health. And one of the things we're talking to a lot of men about are going to be hypertension, diabetes, and most importantly, it is prostate awareness to be screened at age 40. And then they need to get colorectal exam at least by 50. So this has been a great opportunity for us to talk to our parishioners about making sure they're being tested by their doctor, going to see the doctor, because men are probably the worst about going to the doctor. So this is just a great opportunity for us to kind of educate more of the men in our community, and especially within the church. So we're very pleased with the turnout so far, and look to see some great things happening.
To teach people how to look at the label. The nutrition labels is full of information, and a lot of industries nowadays are trying to sell you products and make nutrition claims, but you have to be aware what it means and be careful. You have to pay attention to the amount of cholesterol, the amount of fat, the amount of trans fat and sodium that you have in a product. You want to get more of carbohydrate, more fibers, and more vitamin A and C, as well as calcium. So the nutrition labels is a way for you to get an idea of what you are eating, in addition of looking at the list of ingredients. But the things you have to remember, it's always the number of serving size, the number of calories. Try to get less fat, cholesterol, and sodium, and try to get more carbohydrates, fibers, vitamins, and also irons and calcium.
Representing the dental factor of your health. It's very important for your oral health to people understand that your mouth is an organ, just as your brain, your stomach, and your heart. You have to take care of your mouth. If you don't do that, other parts of your body will not work properly. So one of the things you need to do is, aside from brushing every day, is to make sure that you floss.
And we are representing the pulmonary disease booth.
We're looking at all types of diseases related to lung, especially smoking-related diseases like COPD, because it's one of the more preventable disease processes that can happen if people smoke for a while. So we're giving them education and flyers about so they can take screening and see if they're at risk.
And it's the fourth leading cause of death in the United States. People aren't aware of that. And 90% of the patients have a history of smoking, and that's the main cause or contributor to the disease.
I'm Dr. Leroy Graham. I'm a pediatric pulmonologist, and I'm the founder and medical director of Not One More Life. And we are a volunteer organization that partners with communities of faith to provide free programs of screening, education, referral, and outcome monitoring to address the disparities attributable to asthma and other lung disease among minority populations. We have found working with communities of faith gives us a validated partner in the community to teach and reach people so that we can change these disparities that we see among people of color.
I'm Dr. Vanetta Duhart. I'm an OBGYN. I'm out of Conyers. Robinson OBGYN is the practice that I work in. I'm here today to talk about women's health. Today we have a lot of good information about Gardasil and HPV prevention, which can increase your risk of cervical cancer. Also some other facts about cancer in women, including ovarian, uterine, cervical, and breast cancer. Breast cancer prevention, osteoporosis, as well as heavy bleeding treatments through endometrial ablation, and also some treatments to vaginal infections. So got some good information here. Also OB pregnancy planners for those thinking about getting pregnant soon. But definitely women's health is very important, and should definitely plan to see your OBGYN at least once a year for good annual exams and cancer prevention.
So if I could skywrite anything or get a megaphone and speak it from the mountaintops, it would be for women to do their self-breast exams and to be aware of their breast health and make sure they get clinical breast exams from their providers, and if need be, get mammograms on an annual basis. I found a lump in my breast in November of 2007, and I had just been to the doctor and had a physical, so I was feeling good about myself, and it just so happened that this lump to me popped up 2 to 3 weeks after that. So it was very important that I was doing my own exams and looking out for changes. I am fortunate enough to have gotten a job working for Breast Cancer Network of Strength. And what we do is to provide through information, empowerment, and peer support that no one faces breast cancer alone. I called the organization by chance after my diagnosis, and to speak to someone on the other end of that phone who is a survivor was priceless. So we have an 800 number that is manned by survivors. And the nice thing about it is that they don't give medical advice, they just purely give immediate emotional support. So that was a blessing. And then ironically, a year later, I get a job working for the organization. So it's very near and dear to my heart. It's a very important service and something that I want everybody to know about, because unfortunately, women and men will get diagnosed with breast cancer. So to have that as a resource is just beautiful, I think. Aside from that, I think it's important, like I said, for women to do their annual mammograms and to do their monthly breast exams, and to know how to do that properly is important. So educate yourself on how to do that and make sure that you are diligent with your breast health.
I'm excited today because we're able to finally offer HIV testing. Simon's Call has been wanting to do this for a long time, which is Simon's Call is the AIDS ministry here at Our Lady of Lourdes. And we were able to partner with St. Joseph's Mercy Care, which is our neighbor around the corner, and they are providing free testing today. It's important because testing is the key to getting a grasp on the HIV/AIDS problem in America. A lot of us don't know our status, and if you don't know your status, you don't know if you are at risk or are putting others at risk. And since the African American community is so greatly affected by HIV/AIDS, it's important that all of us, not just African Americans, but everybody gets a handle on your status. So we're inviting everybody to come by today and be tested, and it's a service that we're happy to provide.
We've had an awesome day today, our annual health fair, November 8th, 2009. It's a wonderful turnout with the parishioners. This year we had a lot of our parishioners were the vendors this year, so that was very awesome of having them out. This particular health fair was very informational because it's all about your mind, body, and spirit. You know, come to thee in wellness. That's how you get wellness all the way around. It's just very important to have some screenings done. We had a couple of screenings, especially high blood pressure. Hypertension runs rampant among African Americans, and it's important that we get our health screened, and what a great opportunity here at Our Lady of Lourdes to offer that. Not only this as well, but this year we've had some new vendors. We had HIV awareness testing. I think that is very important. I thought that was a phenomenal turnout as well. And I just think it's very important that we have these health fairs and continue to have these health fairs for those to come and get whatever necessary screenings they would like to. We also have doctors here that can give advice. So it's just awesome. It was just a great turnout. Every year we get better, bigger and better. We just have a phenomenal turnout. It's just a great affair. Hope to see you next year.